also want to let people know that, we want to lay some ground rules of, respect and sharing thoughts and ideas freely, but being respectful to one another on a forum such as this. So I'm going to throw that out there too, and just sort of expect everyone to be kind to each other today. So without further ado, I want to thank our panelists so much for joining us tonight. We have Dr. Jennifer Morse from District 10 Health Department. She is the medical director there. We have Melissa Hilliard-Johnson, who is the, I believe, infection control specialist. Is that the title? Close? Close? Yep. Okay. From Munson Healthcare Manistee Hospital. And then Rebecca Bailey, who is, I believe, in Ludington, and she is a COVID patient. So I think we're just going to start off here, and I'm going to let Dr. Morse take the floor just to give us sort of a foundation or a grounding in statistics and some idea of where COVID is in Mason and Manistee counties.
Thank you. Am I able to share my screen?
You should be able to, yes.
Okay. Okay. All right. And you guys can see that all right?
Yep.
Yeah, that looks good.
Okay. Okay, great. So what I'm going to do is I'll show you some ways that are available to the public to see our data. One that I use quite a bit and one that we use to really help our schools to make some decisions is called My Start Map. This was developed by the University of Michigan with the help of MDHHS. You can look at the state as a whole, and you can then look at your area. So if we want to look at Mason County, we just click on our region. You have to kind of know what region you're in, but then there'll be an enlarged view of your region, and you click on Mason County. I had these enlarged already. Let me get, there we go. So these usually are collapsed. So one thing to look at is what they label our epidemic spread. So how many people are testing positive out of those that are being tested? So we actually have a pretty low percent positivity. So less than 1% of the people being tested are positive. And you can actually scroll and see how that number changes over time. And as was true for most of the state, if you go back to the beginning, it was quite a bit different. The beginning, we weren't doing as many tests. I'm going to try not to make anybody car sick here as I drive around. But if you go to the number of tests per day, you can see in the beginning we weren't doing many. So obviously we were mainly testing those people that we thought were sick. So sure, you're going to have a lot of positivity. The state average, you're just going to take my word for it, but the state average is usually around 2,500 to 3,000 tests per day per million people. So you guys are doing a good job with testing. So you can say, yeah, we're not seeing low positivity just because we're not testing enough people, or high positivity for some counties for that reason either. So if you scroll down, you'll see your cases per million, and some states or organizations use per 100,000, 10,000, and it gets to be challenging to compare things, so we just have to roll with it. But right now you're at about 14.8 cases per million population. Now you certainly don't have a million people. So you'll see this is a running average for 7 days, which helps even out those bumps. Sometimes you get a bump where you have, nobody for 3 days, and then you have 6 people, and so it just kind of helps even it out. So 14.8 per million for you guys is an average of, 0.4 person in a day. So to kind of put that in perspective, at your highest, you were seeing 79.1, and that was mid to late July when most of the state was seeing a pretty big spike. But you guys had hit a little bump. A lot of people had a little bump then, and it's coming down. The state has set, and U of M has set these different criteria. Everyone has community spread right now. Community spread is when people are getting COVID and they don't really know how they got it. They don't remember being around someone who's sick. This is our our gradation of how bad is the community spread. So right now, you're in that light orange category, well, between the yellow and light orange. So you're at medium to medium high community spread according to this, and your percent positivity has you in the low community spread. So that is how that is looked at. Another way, we have a wonderful communications person who does a lot of really good work. I work for 2 other health departments, and she, of the 3 health departments, she does a lot of work with our data. I'm not great with Zoom, so I'm trying to move our pictures around so I can see my screen. So this is on our website. I don't know if you didn't get to see that. This website is just DHD10, which is our health department.org/coronavirus. If you scroll down, there's this data dashboard. It took me a minute in all my genius to realize that if I scroll down further, there's this button here that you can enlarge it. This shows the new counts in each county today, the total cases in each county of all time, probable cases. A probable case is someone who's not been tested, they're sick, and they've been around someone who's had COVID. So they're probably sick with COVID. So that's an official case classification. How many people died today? How many have died total? And then different age ranges and genders. And then you can click through here. You can see how many people we are tracing through contact tracing, how many people have recovered, the total cases each day that we've had throughout our 10 counties, the total cases we've had per each zip code. And then you can scroll through every single county and see how many cases every single day that we've had. And then see the hospital data as well. So I don't want to take up anyone else's time, but just know that, you know, of my 3 health departments, we really have a lot of data available here for you. Let me see, Mason's right here. So to just speed up to right now, so anywhere from 0 to 2 cases a day on average. One little blip there with 3. So, all right. Was there anything else you wanted me to cover before I pass the baton?
Well, I think we'll see questions at this point. I know the questions that I had collected from others were more about the virus itself. Does anyone have questions about the data or how to get to it?
I have a question. We're part-time residents who don't list Mason County or other counties in our DHD area as their primary residents. Were they counted in the data if they tested positive? Like Epworth, some Epworth people live here 5-6 months, but they don't count this as their primary residence.
Right. So where you are living at the time that you get sick is typically where you're counted. The very rare exception to that is, and not necessarily this county, but we've had some times where someone might be visiting from Texas and they come here and get diagnosed here. We'll report that back to Texas because they're not going to be staying here long. But for the most part, you know, if we have students that are going to Ferris, we'll list them as a case in Mecosta County, even though they're from maybe Oakland County, because that's where they're at right now. And again, if you're from, you know, if your permanent residence is Florida, but you're in Mason County for 6 months, if you get sick while you're staying in Mason County, you'll be listed as a Mason County case.
So it's very confusing.
Yes. I have a question.
Yeah.
Why is Oceana County such an outlier around here? Why does it have so many cases compared to Mason County?
Oh, sure. So Oceana County, Newaygo County as well to a lesser extent, in July had several outbreaks that occurred on farms and in some factories. And then those got under control, and our numbers there have been doing much, much better since then.
Thank you.
Yeah, you're welcome.
Other questions about the data? So I think the questions that we had from others were about the virus itself. So one of my colleagues at West Shore asked, what makes this virus so different from the other SARS viruses? Or is it different?
Well, there's coronaviruses in general. So there's 4 different coronaviruses that are just normal seasonal colds. And they cause about 1/3 of the colds that we see each year. The original SARS virus started in China, I think it was 2002, 2003. And then we had MERS, which started in the Middle East in 2012. SARS came from, we think, from bats, MERS, we think, from camels, and then just mutated in a way that it could then infect humans. One of the biggest differences is the contagious period. SARS and MERS were most contagious after someone became symptomatic. So people got very ill, ended up in the hospital, and then a lot of the secondary transmission went to healthcare workers. So the spread outside of the healthcare system wasn't as great, whereas with COVID, people are the most contagious for the 2 days before you have symptoms and the first day or 2 you have symptoms. And you're also contagious if you're asymptomatic. We have people that don't have any symptoms at all. So because you're really really contagious before you even have symptoms, we see a lot of spread in the community. So it's really hard to contain it because of that. Otherwise, it actually genetically is extremely similar to SARS, which is why it's called SARS-CoV-2, because it's very, very similar to SARS, the original. It's just the way it's spread, it just is really, really easily spread in the community. And so it's been really hard to contain it.
Right, right. Interesting. And then is the virus mutating?
So it is showing some genetic changes. The coronaviruses in general just do that pretty easily. And they have found some different strains. It's a good example, if you remember, and this is kind of an example that for people that know viruses, but hepatitis A is kind of similar, where there's different genomes and we can tell, hey, you must have gotten sick in California because you have the California genome. So it's sort of similar to that. But as we talk about vaccine development, it is not changing so much so that there's concern that a vaccine would be ineffective. You know, that we've made a vaccine to how the virus was in December, and now we get it out and ready to go, and oh, the virus has changed so much it's not going to work anymore. There does not appear to be that much change, but it is interesting. They just now confirmed the first, what they feel is the first proven case of someone getting reinfected, and they did that by checking the genetics of the virus. The genetics of the first infection were different from the genetics of the second infection, and that happened in China, and it was a gentleman who was 4 months apart from his 2 illnesses. So that's where it does come in handy, because it's kind of like a fingerprint.
Mm-hmm. That is one unlucky man.
Yes.
Oh my God. Does anyone have any questions at this point for Dr. Morse? If you don't want to, speak, you can also type them into the chat too. That's totally fine.
I know I've noticed coming out of Traverse City area and their health department area, that when there's an outbreak at a public location like a bar or a restaurant, you hear about about it on the radio, even down here. You hear about it on the news. You know, such and such a restaurant had an outbreak if you were there on this date during these times. You know, self-monitor, that kind of thing. We don't get that around here that I've noticed. Is there a reason why? For instance, I know of a daycare where the owner's daughter, public didn't hear about it like they do up north. Is there a reason why there's a difference?
Right. Well, with places like daycares or schools or establishments, churches, they're able to notify all of the people that went there. So we work with those organizations. You know, if there's a daycare or a school, they can send a letter or communicate with it's not a public organization. It's not some place that the public's coming into. So we work with them to send letters and send out, you know, blast phone calls to help them communicate. We don't feel, and we've never felt with other illnesses like pertussis, unless there's a huge outbreak we need to let the public know about, that there's a need to go public and say, hey, there's one case in this daycare. Because again, the daycare can communicate with their parents. We have had times where there's been employees or others that we feel may have exposed several people that we can't identify. And then we have done public notifications. We've done probably half a dozen at least that I can think of. But if someone has had contact with someone for over 15 minutes and they're able to identify them, then we contact those people. If they haven't, if it's, you know, they went into the grocery store and then left and they never had prolonged exposure to any one person, there's no exposure there. So there's no reason for notification. And Grand Traverse does things differently than other health departments does it. They pretty much name everywhere that somebody goes, and that I'm not sure why. I've asked, but it's just not an exposure because those people have just not had more than 15 minutes of contact. They have had other times though where someone has been to a bar for several hours, and those definitely need to go out to the public because they can't identify everybody that has had, you know, prolonged contact with that person. And we've had situations like that. We don't have as much. I think Grand Traverse is a little bit different in their social life, you know, their number of bars and restaurants and things. But long story short, we have put out those public notifications when there's any chance that somebody could have had more than 15 minutes exposure to somebody who's infected and that we don't know who they are, and that's the only way we can tell them.
See, so it looks like we have a question in the chat. Small businesses in our community are required to report contact tracing. Some have had to close down in the past for a period of time due to exposure. Do you know if large corporations like Walmart are also required to document and track exposure in their workplace in the same way that small businesses are held accountable?
So according to the executive order, the employers must notify all their employees if someone in their institution has been found to be positive. Mm-hmm. And they just rewrote that executive order. It's now 175. And they have it different for, you know, office places, constructions. They have all different rules for those different companies. But they are required, if someone is positive, that they have to notify all their employees within 24 hours.
Gotcha.
And they're supposed to try to identify contacts. It's tricky because, you know, I feel bad for them because that's not something they're trained to do. Mm-hmm. They're not trained to try to be, you know, disease investigators. So we really help them a lot with that. But that is in the executive order. So they're supposed to be doing that.
Good to know. Good to know. So I think if we don't have any other questions specifically for Dr. Morse, I'd like Melissa Hilliard-Johnson to speak a little bit about what she does at the hospital. And then I have a couple of questions for her. But Melissa, did you want to talk a little bit about what your job is like? How crazy is it? Scale of 1 to 10?
It's crazy, and it's been crazy for the last 6 months. It's all about COVID right now, for certainly. We have just, again, like the doctor said, we have certain executive orders that we have to follow, and they're changing constantly. The CDC changes their recommendations too, and we have to follow those. So it's just gathering all those evidence-based practices and putting them together and making policies and putting algorithms out for people to follow, screeners, the physician offices, those sorts of things. So it's been pretty intense. And then again, other work comes along.
Right.
Your regular job, yeah, we still have to work that. So, so yeah, that's about all I have for my job.
Just a few things.
Just a few things, yeah. Yes.
What are the capacities for COVID patients in our local hospitals?
So capacities for COVID patients.
Is it like a certain number of beds, or?
There are. In the Munson system, we've designed it so we have regional. So in the southern region, there's not Ludington, but us, Cadillac, and Paul Oliver in Cadillac is our COVID hospital. In the north, it's Munson Medical Center, and in the east, it is Grayling. So we've got 3 different hospitals that will house COVID patients. So if we have a COVID patient come into ER in Manistee and they need to be admitted to the hospital, we send them to Cadillac. And if Cadillac is full, then we send them to Munson Medical Center. Those sorts of things go on. There are contingency policies too, to where if Cadillac, Munson, and Grayling were to get overfilled or filled up, we can change some of our units within a Manistee hospital into COVID units. So we do have contingencies for what if, you know,
Sure,
the plan
right.
A, B, C, yeah.
Are face shields effective?
Face shields effective. So it can really help with like the short-term exposure to large droplets. So people can sneeze, cough, and they can do it in front of your face, and that shield will catch those large droplets. But the smaller droplets can remain airborne, and the shield's not going to protect you from those small particles that linger in the air. So it's really important, if you are to wear a shield, that you have a mask on too. So a shield will help protect your mask. They'll help protect the rest of your T-zone. So your eyes, nose, and mouth is what's considered your T-zone, and those are mucous membranes. And particles can get in there from your hands, from touching something that's contaminated, and you can rub your face or your nose or your eyes and transfer bacteria and viruses into your system that way. So it's depending on what paper or what research you read, you can touch your face up to 23 times an hour. And of those 23 times, half of those are eyes, nose, and mouth touches. So yeah, so it's important just to try to keep your hands away from your face, I guess. Yeah.
Right. This is happening all the time, and we're just now, at least for lay people, this is probably something that you notice a lot more than like lay people, and now we're all of a sudden like, oh, I shouldn't be doing that.
Yeah, it's the shield will help, but absolutely, it's not a substitute for a mask. It really isn't. So just yeah.
Got it. Face shield is not a substitute for a mask.
No, it's not. No.
Does anyone on the call have any questions for Melissa? I have a few more here, but I want to make sure that.
I have a question.
Sure, absolutely.
Recently, we went to our dentist, and everybody in the office had wore a mask, and they greeted us from at the car and brought us in and so on.
Mm-hmm.
But when we went to leave, the receptionist and whoever's doing the billing, that lady sitting there, had no mask. So there's one person without a mask. What is the exact rule regarding that in a dental office? Should she have had one on? Is that it was kind of a surprising thing.
At first, I thought maybe she just had it off because she was talking on the phone to someone, but then she said the rest of the time I was there checking out.
So there are different things that you can do, I guess, besides wear a mask. If you have a like a slider with a slot in the bottom of the door, I don't know if she had something like that. Like
no, she was just sitting at the desk.
Talking to everybody and checking everyone out when we did the billing.
Yeah, well, she should have had a mask on.
But is that required by law? Is that something we should contact the dentist and mention it? Or is that just a particular person exercising their constitutional rights?
Yeah, I don't know. I don't know that person. It very well could have been. It very well could have been, you know, people to, you get off the phone. I know I'm in an office by myself, so I can be without a mask. So I take off my mask when I go in my office, and then somebody comes up to the door, and then sometimes I have to be reminded to put my mask on. So maybe she forgot. I don't know. Giving her the benefit of the doubt here.
No, we're talking about.
She was sitting in an open area reception place with 3 other women also working on the phone and talking and receiving and helping people to check out at the end.
Mm-hmm.
I guess my question is, what's the law about that? Is there any?
I don't personally know a law about that, but it is an executive order that you should be having a mask on.
Dr. Morse, do you know anything about that, like law versus executive order?
From the way I understand it is that the executive orders are, I mean, to me, they're essentially a temporary law under an emergency. And so, I mean, we all should follow them as laws, but I mean, they're not permanent laws, but they're orders. And so, but yeah, when you're in your workplace, you are supposed to be wearing a mask at all times unless you're unless you're consistently 6 feet around. If you're around public, you are supposed to be wearing a mask at all times. If you are by yourself, or you can consistently maintain 6 feet apart from your coworkers, you can take your mask off. So again, we don't know, like she said, we don't know what was going on, or if they have medical conditions or, you know, things like that. But usually the best way to handle that is to call the office and ask for the business manager, and, you know, just make sure you notify them that you felt uncomfortable with that.
Good to know. Good to know. And then we had a question in the chat, and I'm not sure if this would be a Dr. Morse question or a Melissa question. Is it true that people are being found with bacterial infections from wearing masks?
So this is Melissa. I find that if you change your mask and wash it every day in hot water, or you have surgical masks that you buy from the store and you change those out on a consistent basis, more than likely you will not have a bacterial infection. There are all different kinds of ways to get a bacterial infection. Again, are people touching their masks and wiping underneath their masks? And so there's a lot of different things that go into a bacterial infection besides wearing a mask. So I don't know.
So it may not be mask related, it may just be humans get infections.
Mm-hmm. Yes.
Gotcha.
Yeah.
And I'll just add, the main report of those have been, you know, healthcare workers that have had to work insane hours and have had skin breakdown from N95s, and then, you know, whenever you have open skin, you could get an infection. And so I think that's been very rare, and that was mainly in the beginning of the outbreak or the pandemic when, you know, unfortunately we had people in more urban settings that, I think a lot of us saw pictures of those individuals' faces and it just was heartbreaking. But the general public, if you're cleaning your mask and if it's too tight and rubbing the skin, that's an issue. But otherwise, it's mainly those really unusual situations.
Gotcha. Okay, so it's an outlier.
Yes.
It's kind of what I'm picking up from that. Okay.
Mm-hmm.
So I think I know we might still have some questions for our medical professionals, but I want to make sure we have time for Rebecca Bailey, who's our COVID patient. Rebecca, why don't you tell us about your experience with COVID?
I started feeling symptoms around the 21st of March, ish. I don't remember a lot of that time, but I'm pretty sure that's when I started actually feeling symptoms. By that Saturday, I was seeking medical care. I was calling the hotline for a local hospital, trying to get some care. And they said I did not qualify for a test at that time because there were so few of them. They really weren't testing a lot of people. And so I toughed it out. I made it till Thursday of the following week, and then I went to the ER because I have some medical equipment at home because I'm a nurse, and my O2 sats were pretty low. So I went in and got some care there, but they really did not want to treat my symptoms, so I transferred to a different health system where they diagnosed me with COVID, and I started my wonderful journey with steroids, which is what eventually brought me some relief, and I say that with a grain of salt. I was really, really sick for about 4 to 6 weeks, and then I got better to a level, but it was certainly not normal. It was just, I wasn't severely ill. I could get up, I could shower again, but then I'd have to take a break. Simple tasks still will leave me short of breath. I have a stackable washer and dryer. If I put the load from the bottom into the top, I'll have to take a break from shortness of breath. I get coughing fits a lot. I'm on and off steroids. They started with short term, then they went to long term. I'm on inhaled medications.
And you
steroids.
still are.
Oh yeah. Mm-hmm. I'm still very symptomatic. I started something called COVID rehab down south it's been about a week and a half ago. So I don't know what the results of that is going to be like, but it's both assessing my lung capacity, which is not great, my stamina, which is worse, and I lost a lot of strength, just like you're going to do with any illness for that long,
Oh, sure.
if you're that severely ill. And I mean, I knew I wasn't as strong, but gosh, when you see the metrics right there on the paper, I realized just how weak I had gotten. And so I'm still struggling. I was sick for a very long time. I still cough. So it's been more than 5 months now, and I'm still dealing with it. So I guess they would classify me now. They're calling us long haulers, which is a fun term of people who just continue to struggle afterwards. And that's me. So I'm glad I didn't die. I'm glad I didn't need a vent. But I'm still sick, and my provider has told me to prepare for the possibility of having to file for disability if they can't get better, because there's so much that we just don't know yet. And I mean, I'm a high maintenance patient, and they're doing the best they can, but there's just no way to know right now. and talking will set it off.
Oh no, sorry.
It's okay.
We are asking
like I told Renee, I took a lot of my medications ahead of time for this, so I would hopefully not be too bad. I see a question there from my old professor, Mr. Nagel. I was very healthy prior to this. I think he knows how many children I've had since I had him. I have 8 children, 6 of whom are still living at home. And so just by the very nature of being pregnant all the time, I'm health checkups. And that's another thing. I now have high blood pressure. When I first went to the hospital, my blood pressure was 172 over 140. I've got, my kidneys were damaged. I don't have great kidney function now. Same with my liver. And I did not have any of those things prior. And, you know, I can claim that pretty confidently because I get checked so often.
Wow. Sorry. You're already seeing long-term health effects happening, it sounds like.
Yes, yes.
Wow, wow. Has anyone in your family then come down with COVID?
No, which is amazing.
Okay.
Yeah, so one of my children, he's a teenager, is a pretty brittle and severe asthmatic. So we kind of left him up in his room upstairs from where I sleep. We called it his bunker. So we tried to keep, when I was really symptomatic, to keep him away from me and use separate bathrooms and just really have minimal contact at all whatsoever. We'd do some air hugs from, you know, him on the upstairs and me on the downstairs.
Yeah.
But otherwise, it's just too hard. There was no way that in my living situation that I could really isolate myself. And I was still nursing my youngest at the time as well. And so by the time I knew I was sick and COVID was confirmed, well, exposure was long gone, happened. So if he was going to get sick, he would have. But nobody else in my family got sick, which is still amazing to me. I've had an antibody test since, and of course it's sky high and positive, but not everyone in my family has. And we're working with providers to see if we can do that, just to see what their health status is.
Right, yeah.
Another question I think might be for Dr. Morse, but from what I understand, I am classified as recovered, but I am far from it. That's my understanding of how the data is assessed, but I was also not counted in the Mason County data for whatever reason. So there's a lot of unknowns, but I was also very early on, and I don't think they had instituted contact tracing yet, but that's another question for Dr. Morse of when that started in our area.
So recovery is recovery from the actual viral infection. So she would be considered recovered. You know, the post-inflammatory damage obviously is a whole nother misery, which she knows all too well. But recovery is actually recovery from the viral infection. And we were doing contact tracing from the beginning. It's obviously gotten much more efficient and much better. In the beginning, we were all so overwhelmed that certainly it wasn't super efficient. And I don't know why you wouldn't have gotten caught if you lived in Mason County. I don't know why that wouldn't have gotten counted. So something
because I had to go out. I went out of town to get tested because they wouldn't test me locally.
It still should have been based on, it still should have been based on your home address where you live. So, but again, in the beginning, it was an interesting situation, trying to figure everything out. So
yeah, I know I got sick pretty early compared to some people, to the big spikes.
Right.
But I stayed home, so I didn't leave the house except to go to the hospital or a doctor's office for 4 months. I was home. We'd have people like drop things off in the driveway and run for their lives. My church was great. They brought Easter eggs on Easter and dropped them in the driveway. Grocery orders now that you can do that online are amazing. Love that.
Right. Does anyone have any questions for Rebecca?
I do.
Great. Hi.
Hi, this is Ashley Andrews.
Hi.
Hey, Rebecca. I was just curious, do you kind of have any idea where you might have gotten it, or?
I don't think I'll ever know.
Yeah.
You know my husband's profession. He's in contact with the public a lot. That's
Right.
our best guess, because I was kind of a homebody anyway.
Right.
I don't live a very exciting life. I like to sit on my hobby farm with my chickens, and I pick up the kids from school and go to the Walmart, and that was kind of my life previously,
Yeah.
besides online grad school. So, I mean, I stopped going in public. I picked up the kids from school on that Friday when they closed school down, and that was the last time I was out of the house for 4 months, except the hospital. So sometime during that week, I was exposed, and we'll never know.
Yeah. Got it.
Wow. Any other questions for Rebecca? I know just the emotional toll must be really hard, and I think that's something that we don't hear a lot about or don't talk a lot about, is not just the physical from the virus and then the physical, ramifications long term, like you've been talking about, but also just, the emotional toll had to be just really, really heavy.
It's been hard. I don't feel like a good mom because I can't do the regular things for my kids that I would do,
Right?
especially like even during the lockdown times. I'm usually one to do crafts with them, and we go places and we do things, and I couldn't even do the safe things, even just things around the house. They got pizza delivery and microwave meals a lot, especially
I bet they were happy.
and then my husband went back to work, because I can do activity for a little bit of time, and by activity I mean it's very mild activity, and then I have to stop and take a breath.
Mm-hmm.
And I have bad coughing days, and I have bad short of breath days. Sometimes I won't have a bad cough, but I just can't get my breath, or just doing little things around the house, I'll have to stop. And that's been hard because I used to be a doer, and I used to throw 50-pound feed bags around my little hobby farm with no problem. And now at COVID therapy, the therapist was pushing down on my leg and saying, okay, leave your leg up. And he pushed it down. He said, no, hold your leg up for as long as you can. And I couldn't.
Wow.
And so I know that not everybody gets sick, and I'm glad I'm not an event, and I'm glad I didn't die. And so many people have mild symptoms or no symptoms, but there's also a percentage of people like me, and it's just been devastating, and I'm still sick. And nobody can tell me, because nobody knows how much better I'm ever going to get.
Right.
Because I've been on a plateau now for a couple months.
Well, we're all pulling for you. Thank you for sharing that. I'm sure it's not easy. But I think that's, that was one of the things in having this discussion, was to talk about the experiences of real people in our community that are dealing with this. Super important for us to hear about.
Well, I appreciate the opportunity, because sometimes it feels like stories like mine just aren't getting talked about yet.
Mm-hmm.
But I think that's going to be one of the next conversations when COVID is more controlled, when there is a vaccine or there is better treatment and rates start going down. I mean, there's no way to know now, but there's going to be at least a statistically significant portion of COVID people that are going to be like me. And
right.
What's America going to do with us?
Yeah. Oh. So I had a couple maybe more practical questions that I wanted to get to, maybe for Melissa. So if you have to work a whole 8+ hour shift, how should masks be handled? Like when lifting or like taking them off when you're drinking or eating?
Yeah, so that's a really, really good question. Actually, we have training on that at the hospital as a system. So I'm just going to kind of demonstrate here with a mask. If anyone can see me, I don't know, but I'm just going to have it on my face. And so I'm going to go to my office or somewhere and eat, right? So I'm going to do some hand hygiene, put some hand hygiene on. And you always lift it from your ear straps. Never touch your mask with your hands when you're taking it off. And if you are by yourself, you can just lay it like on a little paper towel like this, and just leave it there until you're done eating or whatever you're done doing. And then do some hand hygiene again, and then grab your mask from its ear straps again. And it should be still conformed to your face, and then put it on like that. And just make sure it's over your nose and under your chin.
Gotcha.
Yeah. For storage purposes, I guess, if you are like going home for the day and you don't want to wear your mask, but you want to store it, very simply again, just take it off like this. And I always tell everyone, just handle it by the sides and turn it inside out on itself. So all the dirt is on the inside and the clean is on the outside. And always put it in paper, a paper bag will work. Stick it in there, and then again, do some hand hygiene. And then when you go to take it back out, again, do some hand hygiene. Always hand hygiene or wash your hands before you touch anywhere on your face or your mask.
Yeah. Right, we have to treat it like it's infected, even if we don't know that it's infected.
Right, right, yes, yes. And always, you know, if you wear the cloth masks, it's so important that you wash those. And if for any reason that your mask, your surgical mask is damaged or anything, and it's time for a new one, just get one.
Because the cloth masks we wash every day, right? You don't reuse from day to day, but you have a fresh one every day.
Well, when we were in crisis mode in March and April and May, we were actually wearing ours at the hospital for 5+ days.
Oh, wow. The surgical ones.
Yep. We are now, just this last week, as a matter of fact, we are now down to one once a day. So we wear one and we can get a new one the next day. But we were wearing them for 5+ days. Yeah. So very important to keep it in the paper bag in between uses, just because paper, the germs don't stay on paper as long as they do plastic, so.
And then it looks like we had a question, can you reuse a cloth mask? Like, do you wear it Monday, take it off, put it back on Thursday? Is that safe?
Yes. In fact, it's safer. So we can, I've saved my masks over time a little bit, and I like to wear one when we were still on, you know, once every 5 days that we got a mask. I like to save mine for week to week to week, and then keep my other one for a week, and then wear, you know, by the time it was over, by the time we got to week, I don't know, 5 or 6, I could wear a different mask every day of the week for my old masks.
Okay, so as long as you're giving it enough time for any contamination to die, you'd be okay. Gotcha.
Yeah. And sometimes, you know, masks aren't always, excuse my dog here, masks aren't always, the integrity of them aren't always well. You know, sometimes you'll have little fibers, or your mask will get thin, or you'll get makeup on it, all kinds of makeup, or it will rip a little bit. You know, then it's time to switch your mask out.
Gotcha. And then are there places in the community where people can get free masks?
There are. So the health department did get a shipment of masks in from the state of Michigan. I did talk to the health department number 10 today in Manistee. They do have a shipment in. If you do need a mask, please contact them. They have to wait for direction from the state of Michigan and disbursement. So they're still waiting on disbursement, ways they have to disperse the masks that they get. So there's always regulation behind everything. So they just have to wait for disbursement rules, I guess. But she said, absolutely, if there's an absolute need, please call.
And that was the health department?
Yep, in Manistee, yes.
Okay.
Yep. Kimberly, they do get sticky, Kim. There was a little, masks must get sticky. They do, yes.
You could also get free masks at DHHS, most DHHS offices and community action offices.
Oh, okay. That's Department of Health and Human Services offices?
Yep. And if you go to the michigan.gov/coronavirus, there's a COVID hotline. You can call there and they can tell you where in your area you can get one.
Oh, great. Okay.
Nice.
Yep, they're the ones giving them to the health department. So you can just go right to the source while we figure out what we're supposed to do.
That's good.
Great. So are there questions at this point for any of our panelists?
This is Melissa, and I'd like to just, our lady who has COVID or is recovering from it, just wish her all the best. And I would love to hear from her again in a couple months to see how she's doing. Really would like that. Yeah.
Well, thank you.
I just wanted to, yeah, I just wanted to add a comment too, because we're really struggling with people really feeling like this is not a big deal anymore, and that it's only a big deal if you have comorbidities, and why are we bothering with all this and not wanting to talk to us when we call them. And it's gotten to be a really big struggle lately. And, you know, we're trying to find ways to really, you know, get across that these are real people, and that people that have never been sick are getting really sick and dying and chronically ill. And it's hard because there's just this belief that, you know, what's the big deal? Why do we have to do all this anymore? And I know we're all burnt out on it, but I applaud your bravery to talk tonight. And, you know, hopefully everyone here goes and tells somebody else, and the message gets out that this is a big deal. This is a really big deal. And, you know, we don't know, you know, a year, 2 years, 10 years, what everyone's going to be dealing with after this. So thank you for sharing.
Well, I'm glad I could have a chance just to share another aspect of the story, that it isn't just people who are dying in events or not. There's a whole nother segment too of patients that just continue to be ill and not be able to do everyday things in their lives.
Right, absolutely. Other questions for our panelists tonight? And as I said, if you come up with questions after the fact, please feel free to email them to me, and I can forward them on to our panelists. I'm sure they would all be willing to take questions, you know, in the days to come.
Absolutely. Yes, that'd be fine.
Could they repeat the website that for the that we saw earlier in the program?
I will type it into the chat box as well, but one of them was mystartmap.info, and the other was dhd10.org/coronavirus. Oops, I put that into a private, hold on. Let me try that again. There we go. So mystartmap.info and dhd10.org/coronavirus.
Great, thank you.
I have a question.
Sure.
In what way is the health department working with the schools as far as the kids who are going back to school face to face? What is the connection there, or what?
Yeah, so I've been meeting with them at least once a week since July. We have a meeting, in fact, tomorrow at 1 o'clock. We meet with them every Thursday. I've provided them with a toolkit on how to handle sick staff, sick students, how to help us with contact tracing, what are close contacts. Made a video going over how to use that MyStartMap data to really determine, is the community spread such that in-person school might be unsafe, the risks outweigh the benefits. We go over the data every week. All of the information that we've shared with the schools is on the dhd10.org/coronavirus website. If you go about halfway down the page, there's a blue box that says, I can't remember the main title, but the first subsection is resources for school. So it has all my slideshows, all the recordings of every presentation I've done with them, all the data, everything. So we've been working a lot with them to try to help because they're dealing with a lot of struggles, but our goal has been, to help keep our kids in face-to-face school as much as we can because we know there's such a benefit to that.
Right. So is there a way to know, like, just as a community member, if a staff person at my local school gets COVID, or someone a student gets it and they have to quarantine the class or whatever, is that information available to the public or no?
What the communication plan is that the health department contacts all the close contacts and the school notifies everyone in the building that there's been a case, whether it's staff or student. Because again, it's not a public building. We don't put out a public notification. The school is to notify everyone that's in that building. So the parents of the students and the teachers. The state of Michigan has decided if there's an outbreak, they're going to start listing the names of all the schools that have outbreaks on their website. But that's how our communication goes, is that the school helps us to identify the close contacts, the health department contacts those individuals, but then the school also sends out communication to all the staff and parents and anyone else that would have been within that school, just to notify them of the case. The ones that were not close contacts should not be at a major risk, but we want them to know because we know people will want to know.
What is considered a public building then?
So,
yeah,
like
public school is.
Well, at this time, there's no one going into that building that they don't know about. And if there is, there's a problem. So they should not have people from off the street just coming into the school without anyone knowing about it. At this time, actually, visitors in general are not recommended to go into the school. But if they do have visitors, they're supposed to sign in. So they're supposed to know every single person that's coming and going out of that building. A library would be a public place. A store would be a public place. A store would be a public place. But a school, especially right now, there should not be anyone in that building that they don't know about.
Yeah.
And that's how we handle other communicable diseases like chickenpox or whooping cough. We've never, in my time here, had to deal with measles, but anything like that we've had to deal with, that is exactly how we deal with it.
Okay, thank you.
Yeah.
So it looks like we're just about out of time. If you had other questions that we didn't get to, I'm going to save our chat and then forward those on to people so that you do get an answer. But I just want to wrap up by saying thank you so much to our panelists, Dr. Morris, Rebecca Bailey, Melissa Hilliard-Johnson. Thank you so much for your time. Thank you so much to everyone who came to get this information and share your questions and perspectives. We really appreciate it. So thank you and have a great night.
Thank you all. It was a good questions and good night. Thank you.
Thank you.
Thank you.